Because of the underserved context that we're in, we are really heavy in pretty much any kind of procedure that you might want to do. If you want to learn it and utilizing your clinic to really gain expertise in them, you will get as much experience doing any procedure that you want in residency here.
That is part of that longitudinal care as a doctor.
In Alabama, there's a large population of patients that have colon cancer screening, but if it comes back positive, they need that next step of doing a colonoscopy. Even being in a residency that has family medicine doctors doing colonoscopies is filling this gap. As part of our longitudinal curriculum, I had the opportunity to be part of colonoscopies. We have an endoscopy simulator that we have access to, and we've been able to help change the course of someone's life by finding it early enough.
Osteopathic manipulative medicine is an extra skill set that doctors of osteopathic medicine have to help facilitate healing for patients.
The manipulation aspect is great to help people's pain, and it's a great tool. There's great ways to apply it in lots of areas of medicine.
At Cahaba, I'm thankful that I have the opportunity to practice it.
As a family medicine practitioner, I wanted all the tools in my toolbox.
Kind of approach the patient from a really holistic perspective.
I've been able to integrate OMM almost on a daily basis now.
Wound care is one of the cool things that we get to offer our patients. Dr. J.L. Waits is great. He comes in, he'll give you a systematic approach to any wound.
All of the things I'm doing right now, I can share with the residents here. I can teach them about wound care, and that is something that primary care, family medicine can do.
You get to do all the procedure yourself. And then not only that, but you get to learn about dressings, different principles of healing.
But I've taught them how to treat wounds, and I think they will be able to do that once they graduate from here.
Injections is, to me, something that you only learn by doing. And so the more you get exposed to it, the more hands-on experience you have, the better you're going to become at it. So I've been fortunate to have lots of experiences, both here in the clinic and in other electives that I've gotten to take that have really gotten me a lot of exposure to it.
We get plenty of knee injections, shoulder injections. I've also done SI joint injections.
The attendings are always willing to let you, if the indications show that it's beneficial and could help the patient and you know what you're doing and how to do it.
Specifically with the musculoskeletal injections, we are able to kind of train our residents in that as well.
I think it's always our goal as we're training these residents to practice holistic medicine. That includes the physical, the mental, and the spiritual aspect. As ourselves, as we're seeing patients, as our residents are seeing patients, we're always encouraging one another to pray, to engage in those conversations.
For all of our patients who come in the door, they have a huge spiritual life and spiritual background, and so if we're not addressing those, I think we're doing our patients a disservice.
Having a spiritual community in place like at clinic where we're encouraged to pray with patients and taught to do that well.
Your resources are all right here in-house. It's awesome to be able to provide services like that where normally our patients either might not get access to that or they would have to go to 4 or 5 different locations just to get that care. That happens all right here, which is really cool.
This program has innovated and has done so much for their patients, and it empowers their doctors to do more for their patients as well.